causes of stomach cancer: the pylori bacteria, excessive amount of acid in the stomach, excessive amount of acid in the stomach, excessive amount of acid in the stomach, excessive amount of acid in your stomach. Acidosis is the main cause of all diseases, because your body function in an alkaline terrain. So, can you plant an alkaline food in an acid soil? What's going to happen? Can't grow. And can you plant an acid fruit in an alkaline soil? Had to be neutral. Everything is balanced. So the pH is 7.43, 7.45. When you have cancer, we build it up to 7.5. Cancer can live there. And we give you 1 teaspoon of sea salt in a gallon of water. You drink that every day. My patient's surviving now after 5 years. And we have 3 patients in Grenada now from the UK and Canada who is surviving, which the medical system gave up on and gave them 3 months to live. Now she's living for 7 months now in Grenada, my clinic. Because we taught her to live in harmony with nature. You can never conquer nature. You have to live in harmony with it. And all the cures are found in nature. They're there. We have to look for them. And some of the doctors say, well, you know, herbs don't fix nothing. No, herbs don't fix nothing. Drugs don't fix nothing either. But the body heals itself if given the right nutrition. Because that is the mechanism that we have in the system to protect us and to heal what is damaged. That's what I tell them. And I said to them, well, you all fight on herbs, but where Taxol come from? Taxol is a drug for chemotherapy. It's chemotherapy drug. Where it come from? It come from a plant called yew. Where does cisplatin come from? Cisplatin come from another herb called periwinkle. You see what I'm saying? Periwinkle. Where does the drug digoxin or linoxin, same drug, come from for a failing heart? It comes from a herb called foxglove. So you can't fight on herbs. You have to live in harmony with them. And we practice complementary medicine. So if the doctor give you a drug called Zestril, which is the ACE inhibitor, and we are looking at the side effect of the drug, if the person says, Mr. Dale, I want to come up with my drug, I say, okay, that particular drug caused you to increase potassium in your blood, make you have more heart trouble, so they give you a water pill to push it out. And if they please zinc from the body, and if you're a man, you get prostate problem faster because the prostate is full of zinc. So we give you a zinc supplement. You see what I'm saying? That's what we call complementary medicine. Next chart. Excessive acid in the stomach walls, nitrates, and nitrates smoke foods. That's why China have the most stomach cancer in the world. 1 teaspoon of sea salt. Nitrates, barbecue food is a bad food. Smoked herring is a bad food. They're bad. They're not good for you. Because they have nitrates turn into nitrosamines that cause you have cancer. They have a lot of carcinogens. Excuse me? Only thing barbecue is bad. Shouldn't be. The diet should be 80% alkaline. 80% alkaline and 20% acids. That's where the diet should be. But in the average person, the diet is 80% acid and 20% alkaline. Yeah? That's it. Smoked foods. Now, as Roland was pointing out a while ago, see that organ right here? You can never ever keep it messed up. It's not the organ that breaks down your food, you know. It is what I call this organ here the sewage system. And every one of us lives in a house. We have a toilet bowl in the house. And our sewage system is 20 feet outside the house. But if that sewage system, 20 feet outside, is clogged up, where it come back? In your house. And your house has to do what? Smell, right? There you go. So you got to go get you call them again and clean it up. I wrote a router man. It's the same, brother. Same principle. If you don't keep that clean, and you have a traffic jam, and you have a lot of waste sitting in there, and this organ, which is not supposed to break down your foods, start squeezing because you have so much compact waste and foods and nutrients in the foods that come in here because you have slow transit time. You get inside here, this organ starts to squeeze some of the nutrients in the food and send it to the walls of the colon into your portal vessel, and the liver picks it up, and lots of people have bad livers, and the liver sends it into the bloodstream. You get what we call contaminated blood with acids. And you start to get a disease. And if you don't keep this organ clean, and this organ pH, which is supposed to be 7.8 pH, hydrogen, put it in hydrogen, if that pH changes from what? From an alkaline terrain to an acid terrain, then guess what you get? I'll name a few of them for you. You get ulcerative colitis, you get diverticulitis, you get Crohn's disease, you get mucus colitis, you get ileitis, you get IBS. And mucus colitis, right in the transverse colon, when you eat the foods, and the foods move slow, because you eat them the wrong way, you combine them wrong, and they move slow, and they get in here, you get slow transit time. So the food stays in this organ, we call the sewage system, not being eliminated and get inside there and start to what? Create bad bacteria. And you have trillions of good bacteria sitting there to protect you from harm. But once the old food sitting there for a long period of time, it creates bad bacteria, and the bad bacteria develops, and guess where he goes? He takes over the good bacteria, and he goes right inside here in the walls of the mucous membranes. But your mucous membranes have wisdom. So the mucous membranes start to produce mucus. To do what? To prevent the bacteria from getting in, the bad guy that is. That's good, but you get mucus colitis. And they say that there's no where it's coming from. They have no cause. That's the cause of it. Bad bacteria sitting in the bowels can't move. And the mucous membranes in its wisdom try to protect the membranes from the invasion of the bad bacteria. You get mucus colitis. Ulcerative colitis. I saw a patient today with that. Same principle. All junk foods. Junk foods mean junk foods have no nutrients. They have no nutritional value. They're junk. They don't feed your tissues nothing. They get in here and they cause acid to form in there again. And when acid forms, you know that acid is a bad thing. You take acid and put it in the penny it cleans it up. So when acid gets in there and start eating up at the intestinal walls, you get ulcerative colitis, a big sore inside your belly. But in our medicine, mark them down, you have 8 method therapy. One is called tonification. Tonification. You have to tonify them. Tonification. One is called stimulation. One is called blood purification. Tonification, stimulation, blood purification, diuresis, diuresis, emetic, emetic, purging, sweating, and tranquilization. And tranquilization, they all have a purpose. So when you have a weak organ, because cancer can never ever live in a body that's balanced and strong. Never. I don't care what the doctor tells me. Can't. And I'm proving it every day with my patients who are living up to this day. Blood purification, diuresis, emetic, sweating, purging, and tranquilization. Once you keep these organs intact and in balance and strong, a cancer can never get in. It will come, but you will throw it off. So tonification means that once you have a weak organ, so if the organ is weak in the body, liver, kidney, intestines, lung, heart, if they're weak, you have to tonify them with herbs, because you can never, ever stimulate an organ that is weak. You're going to collapse it and you're going to die. So practice this 8-method therapy. So once you're weak, you have to tonify the organs and get it strong And once the organ becomes strong, you will use herbs to stimulate them. And once you use herbs to stimulate these organs will become strong and kill off the sickness and throw it off. If you have acid in your blood, you can never ever live for long. And when you have too much acid in your blood, your body in its wisdom start pulling out calcium from the bones to buffer it, because calcium and magnesium are buffering agents. So we deal with what we call blood purification. You must keep the bloodstream clean. And you must keep acid from the blood. And you will fix the disease easier. But you can never, ever have acid and toxins in your blood and you want to live for a long, long, healthy. Never happen. Because once you have acid in your blood and your blood have toxins, your eye will suffer because your eye needs nutrients. Once you have toxins in your blood, your liver going to suffer because your liver needs nutrients. Once you have toxins in the blood, the endocrine system will suffer because the thymus gland needs B6 and zinc and vitamin C to function to produce your thymosin so you can produce your T lymphocytes to protect you from cancer. But if you have toxins in your blood, these organs can never, the glands can never function because the blood is toxic. So you must deal with blood purification. If you have a child and the child is overactive or have ads, we tranquilize the child. We don't give them Ritalin. Ritalin don't fix nobody. We give you herbs not to make the child sedated, but to balance back the child's immune endocrine system. Purging, you must purge. Every 6 weeks you must take either colonic irrigation enema or herbs to clean your bowels so that nothing can live inside there, and take some probiotics to put back the good bacteria. Every 6 weeks. That's what I do. I eat once per day, 3 days per week. I eat once per day. My 61 years old. I eat once per day, 3 days per week. And they said to me, I'm going to die. But I said to them, here my answer to them people who say I'm crazy. I said, okay, you eating a pyramid diet? Yes, sir. You eating all the foods on your plate? Yes, sir. I say, okay, so how come the hospital full of you? People like you, so. Because the hospital is full of people who is eating 3 times per day. And a pyramid diet too. Everything in one plate. So how come? The hospitals are full of them. That means they're not eating the right way. They're eating dead atoms. You cook your foods too much. When you cook your foods, you can never ever get nutrients to feed your tissues and your cells. Must purge. Sweating, you must sweat. Because once you sweat, you move a lot of toxins from the lymphatic system. And the lymphatic system is part of the immune system, like your spleen, your thymus gland, and your bone marrow. You must sweat. And you must purge. And diuresis means that when a woman is having a period, and she starts to get bloated fingers start to get heavy, she retain in water, we give her diuresis. Or if a patient have high blood pressure, and the heart is not pumping the blood to the vessel walls well, and the kidneys suffer because the kidney need blood to move the water out, they get what we call swollen edema. We use diuresis. We use herbs to move the water out. We use nettle leaf, we use dandelion leaf, we use overacea, corn silk. They act as diuretic, but some of them act as what we call potassium-sparing diuretic. They move the water out, but they don't make you lose a lot of potassium. Oh, the Most High is great. He put a herb on this earth for every single disease. The endocrine system. I'm 61 years old, brother. Yes, sir. Thank you, brother. The endocrine system, all the glands, hypothalamus, pituitary, thyroid, parathyroid, pancreas, ovaries, prostate, they all need to be in balance, all of them. The hypothalamus is not really a gland, but it feeds another gland called the pituitary gland. And the pituitary gland feeds the thymus, the thyroid gland, and the adrenals, and the pancreas. And there is 2 parts of the gland one is called anterior part of the gland, which is the frontal part, one is called the posterior part of the gland. And the anterior part of the pituitary gland is significant because that's where you make all your hormones, your sex hormones. You know what I mean? And the posterior part of the gland is with your water balance. It works on all the glands. So that is the gland that feeds your thyroid gland, TSH. Follow me now. If you have an imbalance in any one of the glands, you're going to have troubles. If you have troubles in the adrenal glands, you're going to have troubles in the central nervous system. Because the glands work in balance. They're all in balance. Everything is in balance. And the glands, if you have low sugar levels, once your sugar become low, your adrenal glands send a signal to your liver to release wet sugar in the blood. So you see how they work? They work together. See? And the spleen makes your blood, and your liver stores your blood. So when you have low blood as a woman, what we do? We work on your spleen, we work on your liver. When a woman has PCOS, the medical doctor gave her a drug called metformin or glucophage, same drug. And that drug is given to diabetics. But they don't tell the patient that drug causes lactic acidosis, and it causes anemia now. But when a woman has PCOS, polycystic ovarian syndrome, we work on the same gland in the brain called the pituitary gland. And the pituitary gland is supposed to do what? Get a signal from the hypothalamus gland to normalize what? A woman's LH and FSH. And once those two are normalized, then a woman's estrogen and progesterone become normal and balanced. She can never get PCOS. But once the woman gland is not making or balancing back that LH and FSH, she gets PCOS because now her ovaries start to produce androgens, men hormones. She start to get big. Follicles are on the ovaries. And then the first thing they say, take it out. But you must go back and balance the glands in order for it to fix any part of the reproductive system. See? And I'm working with Dr. Sebastian Peters now. He's a doctor trained in the endocrine system, and we're working on a lot of people who have thyroid problems. And we're working with natural stuff and other stuff, complementary stuff, and we're treating people and they're getting better. Dr. Sebastian Peters. When you have cancer in your stomach, that's one of the most hardest cancer to fix. And why? Because where it's at is in the processing center. So I'm just treating someone from St. Lucia. He's a gentleman, 31 years old, who has stomach cancer. And he's in Grenada right now. And he got his cancer from the pylori bacteria. And right now, he took the chemotherapy, and the chemotherapy damaged all his cells. So, couldn't eat anything. Now he's eating, though. You understand? Because why? Because we change around the way you used to eat. The diet had to be changed. And you have to have discipline. You have to live in nature. He ain't vomiting no more. We have a pancreatic cancer patient that came to us, Roland. Is right there? You tell him. It's right there. You tell you. They gave her 3 months to live from since January. Pancreatic cancer, difficult to fix too. They say it can't fix. But the most I put all them herbs on the earth for us to use to balance back everything. Now she's living now. It's July now. She's still living. She ain't vomiting no more. Her hair is growing back. She took the chemotherapy now. Give the Most High the glory. You understand? We have lupus patients, rheumatoid patients, rheumatoid arthritis patients. They're living still. They're better. They don't have myasthenia gravis no more. They don't have rheumatoid no more. They don't have lupus no more. And the medical system said that can't fix. Because he didn't know that everything starts inside here, in the earth. And once you have all these conditions, and you don't have no love, and you have a lot of hate, and you don't have envy and jealousy, you don't have all of that, you can never fix nothing. I teach all my patients that. Forgive your brother, because we are our brother's keeper, and each one teach one. That's the bottom line. The next chart, some herbs now. I want you to look at that now. So they crowd together now. That's where all disease starts from, the earth. See the pancreas? It tuck under your liver. And you got bladder tuck under your liver. Right and left lobe of the liver now. And once you have troubles, this organ here called the pancreas is the most active gland in your digestive system. It works 24/7. So you get diabetes. Why you get diabetes? Because the medical system said to you, your genetics, that's genetics. Oh, you're right. That's not true. You have what we call a genetic predisposition of getting diabetes if you eat the same way your parents been eating. So, this organ, this gland, pancreas, have to get a signal from the pituitary gland in your brain. That's still a part of it. And it do two things. Don't forget now, it only produces insulin, and that's what it does again. It produces enzymes. In the exocrine part of the pancreas, it produces enzyme, and the endocrine part of the pancreas produces insulin. So when you get diabetes, you eat so bad for years and years. And when the food gets into the stomach, it starts to ferment, and then the gland called the pancreas starts to say, man, you crazy. For years you've been all messing me up. I had to keep on producing all these enzymes from the exocrine part of the pancreas. I'm tired. So you wear him out. When you wear him out, when a man can't walk, you have to retrain him to walk again. You have to retrain it. Because in the pancreatic secretion, there's a pH of 8.0, 8.3 alkaline, because your pancreas produces alkaline enzymes. So it must function in that terrain. But we eat so much acid foods that we change the pH in the pancreatic secretion and cause the pancreas to malfunction in the exocrine part of it. So it has to produce lots of enzymes every day. Boom, 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 and they get lazy and weak. And then all of a sudden you say, oh, man, you're messing me up. Boop, diabetes steps in. And they give you a pill for life. But what we do, we retrain the pancreas. And we make it check your sugar 4 times per day to get it back to normal. And in 2 months, lots of people come off them drugs. We wean them off. We take them, wean them off. Take them off gradually. And show them that you could live with a good system that's in balance if you know how. The gallbladder. Lots of people come to me losing the gallbladder. The doctor took it out. How come? Because I had gallstones. So I had gallstones. So the doctor didn't know you could get rid of gallstones. Well, you didn't know that? Okay. Once you have gallbladder stones, that means you're eating bad. And the gallbladder depends on the liver. So when you eat a lot of fat and food and the fats come back into the system, your liver produces bile salts to turn the fat into droplets, and then the droplets go into your gallbladder, your gallbladder emulsifies it. So you could have good hormone health and good joint health. So, the gallbladder right there. But when you start to use the food that is bad and the liver is too bad, the liver cannot turn or can produce your bile salts, the fat stays around in the system and cause all these salts to get into your gallbladder. You get gallbladder stones now. And they pull it out. But we tell you that if the stones are not too big and they can't get stuck in the bile duct, because you have the bile duct is shared by the gallbladder and the pancreas. Now they share one bile duct. If the stones are not too big, you could pass them out without losing your gallbladder. Because once you lose your gallbladder, you can't eat no fats no more. No cheese, no fries, no grease. Can't eat them. Because the most I put them there for a purpose. You understand? So once you could live and know how, you must know how to take care of them organs, man. To avoid eating late at night. Women, do not feed your husband heavy food in the night. You go kill his penis. Because the women feed their husbands. When he's 20 years old, you get married, everything nice, you're having sex 5 times a day. You know what I mean? 4 times a week, 5 times a week. When he reaches 30, 40, you can't have that no more. How come? And he said, well, that's old age. I'm getting old. I'm getting old. I'm 61, I going still for 61. Because when the man come home in the evening time and you feed him a big meal, steak, fries, macaroni and cheese, and he sits in front of the television and eats that, and after he eats, he go to sleep. And for 20, 30 years, he does that. The liver is wood. The kidney is water. He started to get premature ejaculation. He coming quick. Kidney get weak. You're killing him, and you don't even know. So you are killing him unconsciously. And then all of a sudden, you come and you touch him, and he can't raise. He dead. Why he dead? because all the veins and the arteries are clogged up with the foods that he's been eating for years and years and years. And when he reaches 40, he can never, ever get a good erection. He suffers from what you call ED, erectile dysfunction. Because you kill him unconsciously. Because when you eat protein at night, meat protein, and it get into your stomach, and fish take 12 hours to digest in your stomach. Fish takes that. Chicken takes 7 hours to digest. Because fish protein take 12 hours. So you go home at night, you eat a bowl of fish, right? And you go eat the fish at 7 o'clock. And you go to bed at 10 o'clock. If the fish takes 12 hours to digest, and you go to bed at 10, where's the fish? Not in your stomach? It can't go nowhere. Because your system or your stomach do not churn when you're sleeping. When you're sleeping is when all the organs are getting to regenerate and repair your system for the next day. So my advice to lots of my patients is you eat your proteins in the morning. No fruits in the morning. No fruits at night. Because that gland called the pancreas is trying to go to sleep, not to regenerate between the hours of 1 and 3 in the morning. If you feed him sugars, he ain't working now. He starts, that gland called the pancreas starts to work at least 10 and 11 in the morning. When he's rising up in the morning, don't use no sugars. Don't use fruits in the morning because fruits are cooling foods, and in the morning the temperature is cool. You don't burn the sugar up. You kill your pancreas. So you eat the sugars when the temperature is hot because sugar goes up and out. You must burn it as fuel. And if the temperature is not hot, and the temperature is cool, and the fruits are cool, the sugars goes nowhere. Eat your sugars and your carbohydrates and your fats when the temperature is hot, because you have to burn them up. And eat your proteins in the morning. Never eat proteins after 3 o'clock. Treating acid reflux and stomach cancer with herbal medicine and that, betaine hydrochloride should be given to the older people who have acid reflux, but they have what we call hypochlorhydria. They're not producing a lot of acid in the stomach, so we give them betaine hydrochloride. Digestive enzyme, selenium, buffered vitamin C, 10,000 milligrams per day. Buffered, MCP, 10,000 milligrams per day of buffered vitamin C, especially during the day, because buffered vitamin C, the calcium buffers it. It becomes alkaline in solution. MCP, modified citrospectin, IP6. They're the product made by an oncologist, Dr. Jeffrey Dongs, a wonderful doctor from Germany. He created, see that one in the bottom called Holy Immune, I give it to all my patients. And he's a doctor, and he's an oncologist, but he's a wise doctor. So what he did, he put a lot of vitamins, minerals, and herbs together to help with what we call liver detoxification. And we give patients this particular product there with IP6 and MCP, boop, and cancer starts disappearing, lupus starts disappearing. And those are the doctors that we need around, who is open-minded. See? MCP, you know what it means? Modified citrospectin. Guess where it comes from? Tangerine peel, orange peel, and grapefruit peel. What Jehovah put on the earth, the Most High. And guess what they do? When the cancer is, some cancers start destroying the T lymphocytes, you know. And what some of the cancer cells do, they start moving, they start to camouflage. They start to move. They got very smart, you know. They start moving into the blood. And when they start moving into the blood, they camouflage themselves so that your immune system can pick them up. MCP, tangerine skin, orange skin, and grapefruit peel skin. It uncoats them. And it helps the immune system to pick up the cancer cells and kill them. So when you have what we call electron transport system, and you have a free radical stealing one of your electrons, and they become impaired, you are prone to getting cancer. So all these things just stops that. The Most High is great. Yeah? All right, so again, if you want to heal, no hate, no animosity, no jealousy. Live in harmony with nature. Keep the organ system healthy. Take your regular herbs on a regular basis. Clean your system out on every 6 weeks. Do a gallbladder flush to keep your gallbladder and your liver healthy. And do your colonics. You could call Roland 718-469-0985. Get your colonic done, and you will be okay. Give the Most High all the glory. Blessed love.
We're going to have the question part of the program now. What can we do to heal the condition of severe scoliosis and its effects? Numbness in the leg and feet, lower back pain.
When we're treating scoliosis, we also go and work on the immune system. and we also work on the lymphatic system. We use a product called burdock red root compound.